Maybe another piece, but that's okay. Well, thanks, Sonia. I hear echoes of reach, and Tosca, new generation, etc. Well, with that, Judy, we have your new presentation uploaded. We have a fantastic, nimble staff here. So there you go. We have 7 minutes.
Thank you. Can you hear me?
Yes, please.
Great. So I think where I left off was noting that I was going to focus on a topic that has been underrepresented. And so yesterday there were a number of references made to epidemiological research that demonstrates the obesogenic nature of some environmental chemicals, and a few papers on BPA and phthalates were specifically mentioned. And as it turns out, a couple of years ago, my colleagues and I got interested in understanding what the totality of the epi-literature was telling us about the relationship between chemical exposure and obesity-related illnesses. So we conducted a comprehensive systematic review of the epi-literature on BPA and phthalates and their associations with obesity, diabetes, and heart disease. And these papers appeared in Critical Reviews in Toxicology last year. I can't show you all of the results because there are 6 minutes here, but what I'd like to do is share 2 results with you, the ones on BPA and obesity and BPA and diabetes, and then simply say that we found the results that I'm going to show you, we found for BPA and heart disease and the phthalates as well. And I want to show these to you because these really form the underpinnings of some research and policy needs that I'm going to mention in a couple of minutes. And let me just say that the next 2 slides they're busy and they're messy, and I don't expect you to see the details, but I think I can get the main point across to you quickly. So if I could have the next slide, please. So if you can see that, I know there's a delay here, but yeah, there we go. So like I said, busy and messy, but let me just explain what the table shows. First of all, these are all the studies that were published at the time of our review on bisphenol A and obesity. So each row indicates a separate, unique study, and you don't have to read the text there. Just know that each one's a different study. What the columns show you are the different approaches that researchers use to define obesity. So obesity as a yes-no, body weight, body mass index, and so on. It's the colors in the cells that are important. So what these are author-reported results. So if the authors reported a positive, significant result, you'll see red in the cell. If they found a significant result but inverse, so more BPA, less likelihood of the outcome, we color that in blue. And the green cells are the author-reported results that were null, and yellow indicates mixed. So I think it's pretty easy to see when you look at this table from kind of a 30,000-foot level that, first of all, we have a pretty large number of studies. I mean, in the epi world, to have this many papers on one chemical and one outcome, this is pretty good. But what we also, I think, can readily see is that the results are inconsistent. If you look at a single study going across a row, you see many instances where the authors found inconsistent results. And certainly if you look down a column and look at a particular way that the author identified obesity or categorized obesity, again, you see inconsistency. And so when you look at the totality of the data, I think what you'll see is that it neither supports nor refutes the hypothesis of an association between BPA and obesity. So if I could have the next slide. So these are the results for BPA and diabetes. And in this case, you'll see immediately that we have fewer studies here, but still a number of them. And again, color coding is the same, and rows are studies, and columns are the various ways that people studied obesity, so physician diagnosed or insulin resistance and so on. And again, we have a lot of inconsistency in the outcomes of these epi studies. And as I mentioned earlier, we got the same results when we looked at BPA and heart disease and phthalates and all the outcomes. So yesterday, Dr. Valvi noted inconsistencies between outcomes that are derived from animal versus human studies. But I think the quick look at these tables here demonstrates that we have similar problems when we only look at the human data. So if I could have the next slide, please. I think there are a lot of reasons why we're seeing this outcome from these systematic reviews, and I think these are the ones that are tied to research and policy needs. And there are probably dozens, but I have time to just bring up a few. The first is that what we're looking at here are studies of short-lived chemicals. And we got really good at trying to measure and interpret data on persistent chemicals like the dioxins of the world. But we're in a kind of a new world now. And we're relying on measures of exposure that are unlikely to properly capture true exposures. And this is going to give us exposure misclassification in these studies. And it's certainly the case that in these studies, they've included too few samples to capture the variability that we know occurs from hour to hour and day to day and for longer periods of time. And in fact, this is a problem that's acknowledged in most of these papers. The second point that I raise here is that we're still struggling with matrix adjustment issues. So most of these studies are looking at urinary measures of these chemicals, and we know we have to figure out some way to adjust for the fact that dilution of urine is going to be different from person to person and day to day. But the best approaches for doing this are still being debated, and the method itself can have a significant impact on the analyses of associations between exposure and outcome. And in fact, depending upon the method you use for matrix adjustment, you can have a completely different result in terms of what you see in your association. And the third point I'll bring up is that we have a lack of interstudy design consistency. And so when we're trying to do things like weight of evidence assessments, we want to look at all of the data. But if our studies are conducted in very different ways and we report out our data in very different ways, it can become virtually impossible to do things like meta-analyses. And that's a limitation that I think we can move beyond. And I also mentioned diet here because it's been raised, well, many times in the last day and a half, and it was raised as an issue yesterday. And in the context of BPA and these epi studies that I just mentioned, we know that diet is one of the main exposure pathways for BPA, but diet's also critical to understanding obesity and obesity-related disease. And yet almost none of the studies in those previous slides considered diet as a confounder. So the take-home message, I think that as a matter of policy, we need to support research that promotes and that provides higher quality exposure estimates if we're going to be able to use all of these studies in public health decision-making. I think, in addition, based on what we heard in the last couple of days, these exposure characterizations really need to start incorporating a broader definition of exposure. And then the last slide. I just wanted to mention these are the citations for the systematic reviews. You can see who my co-authors were. The last citation is a paper stemming from a workshop in which we developed an instrument that can be used for evaluating the quality of exposure data. It can be used for activities like weight of evidence assessments or manuscript or grant proposal review. And this may be a way to help us move toward better exposure characterization in these studies. And thank you.
Thank you, Judy. In the interest of time, we'll move on to our last speaker, who's going to take us over the finish line, who has both a healthcare professional, academician, and a researcher, Dr. Sheila Satyanarayana. Sheila?